If you're studying for the INBDE, I highly recommend INBDE Bootcamp, an all-in-one study resource that will help you pass your exam. Use coupon code MENTALDENTAL for 10% off. Hey everyone, Dr. Ryan here, and welcome to Mental Dental. I talk a lot on this channel about getting into dental school and also getting through dental school. But your dental journey doesn't end when you finish dental school. In fact, it's only just beginning. And so this is the first video in a 3-part series I'll be making on communication. Communicating with your patients, communicating with your staff, and communicating with your colleagues. And so this one will be all about building patient trust. And studies show that trust enhances patient satisfaction, improves treatment adherence, and reduces dental anxiety. Without trust, even the best clinical skills might fall short. And similar to a car mechanic, patients trust us to diagnose a problem and treat that problem, whether they can see it or not. And so a patient won't know if you leave an open margin or an overhang on a restoration until that restoration fails down the road. Of course, it's our moral and ethical obligation to always be upfront and honest with our patients. But how do we initially earn that trust? Well, let me give you several pieces of advice. Number 1, create a welcoming environment. So you want to ensure that your dental office feels warm and inviting. Train your front desk staff to greet patients with genuine smiles and empathy, to speak politely on the phone when they call. And all of these are simple but important steps before the patient even meets you. Number 2, respect their time. So you want to start your appointments on time whenever possible. Acknowledging the value of your patient's time shows respect and builds credibility with them. Number 3, knock. So before entering the room, always knock on the door as you walk in. Of course, you're going to enter the room anyway, but knocking displays a sense of politeness and consideration. It's really easy to implement, and if it helps even just a little bit, then great. Number 4, a professional and friendly greeting. So when you walk into the consult room, you want to do so calmly and confidently and in a professional and friendly manner. The first appointment is really important to set the tone. So here are some things that I often say. Hi, I'm Dr. Ryan. I'm so glad that you're here with us today. It's my pleasure to meet you. May I offer you some water or something to drink? What brings you in today? Ideally, I would shake hands with the patient. I'm still old school like that. And definitely use your name and use their name. Now, using the patient's first name or more formal Mr. or Mrs. is a judgment call. Often people, if they're older, prefer the more formal greeting. It just kind of depends. Number 5, sit down. So I always recommend sitting down with the patient for that first appointment. Research actually shows that when a doctor sits down, patients perceive them to be in the room significantly longer than doctors who stand up. Patients have also been shown to be more satisfied with their care when the doctors are sitting down, and it's also more comfortable for you instead of towering over the patient and peering down at them. So I would recommend, seriously, take a few minutes before you get into all the dental stuff and just have a conversation with them. Share a human connection with them. No gloves, no loops, and if possible, no patient bib either. Remember that patients are people first. So asking about their family, their hobbies, or recent trips that they took can help humanize the interaction. And I also like keeping personal notes about the patient's hobbies, their pets, vacations planned in their clinic chart so I can ask about that next time that I see them. Number 6, let the patient speak. So studies also show that doctors interrupt their patients after an average of just about 20 seconds of speaking. Nobody doubts how busy you are as a dentist, but give your patients a chance to speak. You never want to make them feel like you're in a hurry or in a rush to get to the next patient or the next task that you have on your list, even if you are. But do be careful with this, because some people will tend to go on and on if you give them the floor. There's a fine line between being their dentist and being their therapist. So politely redirect the conversation back to their teeth if it's necessary. Number 7 is listen actively. So pay close attention to whatever the patient says without interrupting. Nod, maintain eye contact, and when you can, repeat back the important points to them to show that you're listening. And I never recommend asking, "What's your chief concern or chief complaint?" even though that's ultimately what you want to find out from the patient. Instead, ask, "Are there any goals that you have for your smile? Or is there anything about your teeth that I can help you with? Or during this appointment, what's one question that I can answer that would make you happier today?" It's an alternative way to ask about their chief concern, but with a more positive and uplifting tone. Number 8 is super important. Avoid technical jargon. Remember, you are in a bubble of dentistry. You're so used to using all the dental lingo from dental school and your board exam, but now you have to translate for your patients. So use as many basic layman terms as possible. Instead of restoration, say filling, gingiva, gums, enameloplasty, recontouring your teeth. Find the language that the patient will best understand. Number 9, give them a chance to ask questions. So you want to be honest about their treatment plan, provide the menu of options for them, include benefits, drawbacks, alternative treatment options, and what you genuinely recommend for them. And then always make sure the patient understands everything that you've told them, and never end a conversation without asking if they have any questions. And last but not least, number 10, end on a positive note. So always finish your conversation with a positive and with a statement of encouragement for this patient. Even if it's just, "Hey, coming to the dentist is not a super fun thing to do, so just be proud of yourself for taking this step and being here today." Building trust with your patients isn't a one-time effort. It's an ongoing commitment. And so by implementing these tips and creating positive first impressions, communicating effectively, showing empathy, and following through with action, you'll not only build trust, but also foster lasting relationships. So thank you so much for watching this video today. Don't forget to like, comment, and subscribe to Mental Dental for more tips and insights like these. And stay tuned for part 2 of our communication series, where we'll discuss building strong connections and how to lead your team. So I'll see you in the next video.